Welcome back, everyone. Greg Essenmacher, Two Sleuth Podcast. So excited today to have on Dr. Charles Moser. Wait, is it Moser or is it Moser? Did I get that right? I should have checked in.
It's
We'll
I'll
we'll
res-
figure it out in post.
yeah, I'll respond to
Is it
either. It's actually Moser.
Moser? Okay, yeah, just don't call him late to dinner. So, Dr. Moser's owned multiple practices before taking a position as the dental director for a DSO. Duties overseeing 40 plus associate dentists. Boy, that's like wrangling, right? And 200 team members. Became a key member of the DEO, the Dental Entrepreneur Organization, serves as an executive coach for dental owners. And we'll talk a little bit more about that organization. Love that group. Speaker for the John Maxwell team, as well as KOL for Dentsply. Spent years of his life as an in-office consultant, serves as a claims reviewer. Boy, there's just so much that he's done in his life. I'll let him talk more about that. Thank you and welcome, Charles.
Yeah, thanks, Greg. I appreciate you having me here. It's great to be here.
Yeah, I love it. So much that you've done. So I want to start at the beginning. Well, I don't want to start at the beginning because that would have been, when you were actually born. Although you can talk about that if you want to, but I'm sure my team wants to know, and those that are listening want to know. All of my audience wants to know. So you started out clinically, and you own multiple practices. So talk about the journey going from that into the entrepreneur world.
Yeah, it wasn't my choice. The long or the short story is I had an accident that injured my practicing hand in 2006. And I had three offices. I was doing cosmetic restorative dentistry, enjoying life. Things were good. And then life had a different plan for me. And when my hand healed, it just didn't come back the way it was before the injury. And I tried for about another year and a half to continue practicing, but just decided that there was probably another path for me, and it was to take my experience to that point, add some more layers of experience through John Maxwell's leadership training program and through becoming a dental director and a mentor and a coach, and have an impact on dentistry that way. And so, I'd like to think that I don't quit, I don't give up. I just figure out how to reinvent and use the new tools that I have to take out into the universe and do what I can. And hopefully, I'm doing that.
Well, and what a great testament to being where you're at, having life throw you a challenge, the good man upstairs or the universe or whatever you believe in saying, that's not really your path that I want you to stay on. I'm going to nudge you to the left or nudge you to the right. And this is where you're going to go now. And then being able to realize, wait, I have a tremendous skill set. So I'm going to up level my skills and I'm going to learn something a little bit different. And then really becoming dental director sounds like of a DSO. And if that, I mean, that was probably was that the mid 2000s, late 2000s when you did
Yeah,
that? Yeah. I
yeah,
mean, back
yeah,
when
yeah.
I don't think most people even knew what the acronym DSO meant back then or what it was back then. I know I was just starting to learn. That was when I first got into dental, right? And being able to manage a team and oversight for a team of that size, and what a great opportunity for yourself, and then transitioning into other roles. I love that. So tell me a little bit more about your introduction to the DEO, the Dental Entrepreneur Organization, because they actually help individuals who are dentists or in the dental field transition into entrepreneurship. Am I correct in that? Tell me a little bit about your affiliation with that group and how you got to know them and the work that you did with them.
Yeah, sure. Absolutely correct. Timing is everything in this world. And if you keep looking long enough and hard enough, then the timing works out, right? You're not going to just get to sit on your behind and wait for timing and opportunity to knock on your door. You've got to be out there ready for it to fall on your head. And so when I was with the DSO, we had grown to almost 100 locations. We had one exit in 2009, which again, I think we actually put the letters DSO together. I don't really know that those letters were together. We sold to a private equity group out of Alabama in 2009, and the attorneys used the MSO model at the time to create that sale. So, it wasn't being done a lot, and then in 2017 the private equity group exited again. And so we had another transaction take place, which is extremely rare. And And the culture of the organization changed dramatically. You know how those things go. The new guys come in, they bring their new team. They had a new model that they were going to try. And so, a lot of people just end up out of work, and that's not a bad thing or a good thing. It's just the way it goes. And I ended up talking to Darren Akapan from the DEO just on a phone call. I ended up talking to the legendary Mark Cooper on a phone call. And Mark said to me his classic line when we were on the call. He said at the end of this phone call, if it was a success, what has happened for you? And by the way, if you're somebody watching this and you're wondering how to have a difficult conversation with someone, that's a great way to open the meeting, is to ask them at the end of this meeting, if the meeting was successful, what happened? Because it just really paints the bullseye for you to actually direct the call to and the conversation. So it's a great question. And I was all ready to say to Mark, I knew that question was coming, and I was ready to say to Mark, well, I hope that you'll introduce me to a dozen or so DSOs so that I can continue my work as a dental director, maybe even a chief dental officer. And instead, what came out of my mouth was, at the end of this call, I'm hoping that I am working for you in the DEO. And I have no clue why that came out of my mouth, but that's what came out. And he said, well, that's very interesting because we're kind of looking for someone currently to come in and kind of be his sidekick and do the existential leadership and who are you type of, who do you want to be type of thing. And I became that guy. And it was amazing. I had a almost 5-year run with the DEO, and I couldn't thank them and be more appreciative for what they did for me. And I hope they feel the same way about working with me.
Well, and what you say and what you just shared is when you're trying to have this challenging conversation at any level, whether it's in business, personal, you name it, to be able to frame it at the very beginning of the conversation and talk about what would a successful outcome look like for you, or what are you hoping to accomplish in this conversation, or whatever verbiage you want to use. I'm a big fan, not so much of scripts but of frameworks, right? And I teach, coach, and train this with full arch clinics all across the country, of creating a framework that sounds like you, so it's authentic and it's natural, but creating that right up front in the beginning of the conversation, whether in person, over the phone, through Zoom, whatever it is, whatever platform that you're using, to do that establishes the parameters for that discussion to happen. And that way it almost prepares the listener, the receiver of the message, to be ready for what's coming next. Because there are times we have to have challenging conversations with individuals, and that's okay. And it's when we avoid those conversations, when we're avoidant, that problems occur down the line, that we run into serious difficulties down the line. And in business, what that can mean is in partnership where they fall apart and end up in litigation, in deal making, in mergers and acquisitions where there are faulty assumptions and a lot of time, energy, and effort and money is spent, and those deals end up falling apart. And so, especially in general, but in the lane that I work in the fixed full arch, it so much so it is just high stakes in every step of the way. And it works with treatment coordinators, working with patients. So across the board, when there are some difficult, and it works with people management side as well. Have you found that to be true, in addition to how you shared it and framed it with the conversation you had before you started working with the DEO?
Yeah, I'll even dovetail into that the word interpretation. So you did a great job, and I don't need to recount what you just said about creating the framework for the conversation. And then the next step of that is, are we receiving the information and interpreting it the way that the speaker is expecting it to be interpreted? And frankly, the answer is almost no all the time. And it's the book Radical Candor, where she talks about communication happens at the ears of the listener, not the mouth of the speaker. And I use that to let people know that the responsibility of the communication is the speakers, not the listeners, because the listener is interpreting what we are saying however, they are interpreting it. And unless I say to you, Greg, what did you hear me say? And get some sort of confirmation that you actually heard something, anything, right? I've asked that question so many times and had people look at me like, um, tell me again. And it's like, exactly. I'm happy to tell you again, because people don't expect to have to regurgitate back to you what you said to them. And if I send somebody out of my office to fulfill a request and they haven't interpreted my request the way I wanted it to be interpreted, then as a leader, I am setting them up to fail, not to succeed. So, yes, frame the conversation. It's a strange question to ask somebody at the end of this meeting, if it's successful, what's happened for you? But it takes them and puts them into the right context for that conversation, and then clarify what the interpretation is after you have had some sort of dialogue with somebody. And man, oh man, accountability goes up, responsibility goes up, success goes up in your teams. That's what I love to talk about. You took me right there, Greg.
Well, and I so appreciate what you pointed out, because what you're talking about as well is, the receiver of the message, right? It's the interpretation. It's, do you speak the language of the listener, and are they interpreting the message? Because we're all filtering through our own interpretation, through our own experiences, the place that we're coming from, right? Through our own life experiences. And this is exactly why, coaching to those that are taking lead calls in full arch, from all of those great lead sources, right? The form fills, the surveys people are filling out, or the phone calls that are coming in. For myself, a 52-year-old white male that grew up in Detroit, in lower middle income, is going to have a much different life experience than a 27-year-old Hispanic female in Houston, Texas. And speaking with the 7 different personality types of patients that are going to call and that they're reaching out to, and trying to have this emotional connection of a conversation in order to get them to go from a lead call to booking a consult. And then if there is some skin in the game, to actually showing up, to reduce your no-show rate, to give an opportunity to be able to get a patient, to move them to, you see where I'm going here with it. And that's why scripting necessarily isn't something that is as effective as what I believe, which is more of the framework, right? More of formulas that make sense, because people come from their own life experiences. And that's what I think is so critically important. And that's one of the reasons why I think dentistry is, especially when you get into the bigger cases, right? But in general, why dentistry, if you look at the numbers, right? If you look at what are, the top 5 professions for, suicide, although you look at the top 5 professions for satisfaction, why is it that dentistry is one of the most challenging, difficult professions out there? Well, I won't try to answer that. Let me ask you that, as a former practicing clinician, and now somebody who's in leadership, and somebody who's seen the DSO landscape from pretty much the inception, and then working with DEO and helping dentists to become entrepreneurs. What's your perception of that? How and why is that?
Yeah. Boy, how long do we have? I was asked last night on a call what my why is. And I withdrew from the question and gave a very generic answer. But I'll tell the story now that I'm here, if you don't mind. And that is my best friend from dental school died at the age of 48 of an overdose, basically. He was a fantastic cosmetic dentist, but could not run a business. And it led him to abuse of substances and things of that nature. And so I think the challenge that we have as dentists is we spend however long in college, 3, 4, 5 years, 4 years in dental school, perhaps a residency program, and no one talks to us about how to run a business. Now, they may offer a business course in dental school, but we don't take that course because it's not on the state boards. So we are not there, We are waxing crowns is what we are doing. And so we get out into the world and find that all we really want to do is help people. I think dentistry, when you talk about the satisfaction of the industry, dentists are typically people that want to help other people. I really don't find many dentists that don't want to do a good job. What I do find is dentists that are challenged with other things that they didn't learn in dental school. How to have difficult conversations, how to read a P&L, how to negotiate a list, how to hire people, train people, and onboard people for success. These are all things that if you don't do well, your clinical expertise doesn't really matter. So my why, as my journey from the chair to out of the chair transpired, I just recognized that maybe I could have a bigger impact on the industry by working with dozens and dozens and perhaps even hundreds of clinicians and team members rather than one patient at a time. And if I can help clinicians and teams be more effective, be more efficient with better systems, and bring some joy back into their day, and let them know that you don't need 100 patients a month to be successful. Let's do a great job with the patients that are coming through the door, diagnose comprehensively, add value to what we're doing, have an amazing patient experience, and get people to come back and finish their treatment plans. And Greg, this is an interesting KPI that I've tried to follow over the years, is treatment plans completed, because that means you're getting people healthy. Not just start the treatment today. Oh, we did the crown. We did a crown and a filling today. We did $2,000 of same day treatment. That's great. But are they coming back to finish their treatment? Are you getting them healthy, or are you just unclogging the toilet, and then you're leaving the house, right? I mean, we need to have our toilets unclogged, but we're in the profession of getting people healthy, not just doing tooth of the day dentistry. And you talked about the experiences. The word that I like to use is biases. We come to the table with different biases about how we hear things. And the biases can be good or they can be bad. And here's the word that I'll throw out that will make everybody just recognize what I mean. And the word is consultant. You use the word consultant, and some people are going to go, never again. And other people are going to go, greatest thing that ever happened to me. So there's not a better word to use to kind of get the point across that we all have certain biases based on our experiences as we've gone through this crazy thing we call life.
Yeah, I appreciate that too, because, being a consultant myself, hopefully they've had good experiences with me, and most of mine do, because all my business is referral, and I appreciate it's kind of like the Hillary Clinton of dentistry, right? Either love her or hate her. There's no in between. There's no middle ground.
That's my point.
Right,
exactly.
Yeah, it truly is. It truly is. But you talk about what your why is, and I talk about this all the time, right? The why behind the what is what full arch dentistry is all about. It's the motivation of the patient, not so much the product itself. I talk about this all the time at a lot of the Full Arch Implant Institute courses, and that's what I'm brought in to speak on, the business side of dentistry. Right? Because the business side of dentistry, which there are some dental schools that say, oh, no, we send our clinicians, we send our doctors when they get their DMD or DDS, they are well-versed in business and they know what they're, and I'm so glad when they start talking like that I'm wearing like shorts or not long pants, because I don't want the BS, the crap, to get on the bottom of my pants, because it's just not true. There just isn't enough of that. And that's why you have individuals out there that are helping to educate clinicians on it. And I also believe that's why the consolidation is happening at the rate that it is, because there are groups out there that are helping with the everything else of dentistry that's non-clinical, because they can do it more efficiently and take it off their plate. Now, I'm not saying one way or another that that's good, bad, or indifferent, but for those that need that help, because there are some dentists, I know some personally, that are good at business because they've put forth the effort, whether they've gotten the formal education or they've gotten the post dental education in that area and really learned it and honed the craft and become a student of it to get really good at it. And I think that's important to know. And you also mentioned, and it clued in on something, because this is something that I don't think we talk enough about in dental, which is, you talked about joy, right? What brings you joy? What brings you joy in your life? And if you don't have passion behind it, why do it? And that's where people make emotional decisions rather than business decisions. And that's sometimes where you, I mean, how many times have we met clinicians, right? They make a purchase and you're like, well, why did, what? And it's an emotional decision, right? Because it brings them joy. It's a shiny new toy. So let me ask you this, Charles, so what brings you joy in your life?
Well, certainly most of that is outside of work. I mean, what brings me joy
Good. I'm glad to hear
is
that.
the same thing. Yeah, the same thing that brings probably all of the listeners joy, and that is spending time with my family for sure. I have a wonderful wife of 36 years, all in a row, and I have two amazing children. I love to play golf. I love to be outside and exercise. Um, I typically try to run or do something in the morning, and again, I'll pass this off as a little tidbit to the people listening, and that is try to do something in the morning that sets you up for success throughout the day. It's not too far off of Admiral McRaven's "Make Your Bed" speech, from the University of Texas. If you haven't watched that keynote speech from the graduation, I think it was 2018. He talks about "Make Your Bed" because it's a simple task, but you've already started the day with a win. And so I would really ask your listeners the question, are you starting off your day with a win, whether it be meditation, whether it be prayer, whether it be exercise, whether it be getting the little ones off to school, which can be challenging, but enjoy those times, right? I mean, look, when my kids were young, it was great times when they were a pain in the neck. But start your day off by doing something that sets you up for success for the rest of the day. So uh, I think that, Greg, what brings me joy, moving it back to a professional standpoint, is kind of when people have that epiphany of, you know what, if I play this game right, and if I value my team and inspire my team and empower my team to take risks and to say yes, if I give them the grace to say yes to where I'm not the bottleneck for everything, then given enough time with that model, the clinician will be able to sit at the chair and do the things, hopefully, that brings them joy, which is get people healthy. Now, maybe it's be an entrepreneur, but you can't be a clinician. You can't be an excellent clinician, and you can't be an excellent entrepreneur if you're the only person that can say yes in your organization. Because every time somebody comes to you and says, we need more Seafold towels. Can I buy them? Yes. We need more water for the concierge bar in the lobby. Can I buy more water? Yes. I mean, you just need to get all of that stuff off of your plate. This is not a Southern style kitchen where the chicken fried steak should be lapping over the edges of the plate. Your plate should have on it what you do and what only you can do and you do well. And if so, I think professionally, we'll find that we can bring joy back to people in the realm of dentistry. I think it's a confusing time right now.
Yeah, I was laughing to myself because I'm thinking of I think it's called Bear, the show. And as you're saying that, it's like, can I buy Seafold towels? Yes, chef. Can I do this? Yes, chef. And just this is what I'm hearing in my mind. So that's why I was laughing. I really enjoy. You were talking about the simple act of making your bed in the morning, and it took me back to uh, Whitney Johnson. She has a podcast called Disrupt Yourself, and she was the keynote speaker at the AADGP, the American Academy of Dental Group Practices 50th anniversary meeting that was in Las Vegas a week and a half ago. And she was doing an exercise with everybody talking about start with something small that you can do for a small period of time. And I think somebody in the audience said, my goal is to make my bed every morning for 1 week. And that is a manageable goal. That is something you can do that will give you that win. And so that was, that's what it reminded me of as well. So it's really just setting that, you said it, right? You start with, give yourself something where you can start the day off with a win. And we talk about that too. I'm in recovery and have been for quite a while. And that is one of the first things when I start working with others that are in recovery. It's like, make your bed every day. You get up, you make your bed. Because it doesn't matter what happens the rest of the day. At least you have a win. So I love that
Yeah.
you shared that. That was really important, and it
Well,
brought
if
back
you
some good
haven't
memories.
seen it, have you seen
I have.
McRaven's keynote
I
speech?
have. I
Okay,
saw
all
it
right. I
many
mean,
years
because
ago, and I hadn't thought of
it's
it. Yeah,
fantastic.
it really
Yeah,
is. It's very
yeah,
powerful. It's very powerful for sure.
yeah.
All right,
It
Charles.
is
This is the point of
fantastic.
the program. Every one of my guests has played. It's called "What the Sleuth
Okay.
is Going On." 3 rapid fire questions. First thing that comes to mind. Are you ready to play?
No, but let's play.
I love it. I think you're the first person to say no.
Well,
Question number 1.
you don't know what the first thing that can come out of my mouth is.
And I'm
so
good with it too.
my-
I've got a really good producer. She'll edit it out, but probably not because it's my podcast and we say just about anything.
Okay.
Question number
Here
1.
we go.
What's the worst bad breath you've ever encountered?
Oh, well, we call it perio breath, which is where you can smell it before it even enters the room. Takes me back to the George Carlin skit where he used to say, anybody's got bad breath, Marge, but you could knock a buzzard off a shit wagon. So, yeah.
Love me some
it's
George
that
Carlin.
perio
He's
breath.
great.
Yeah.
He's great.
Yeah.
Love it, love it. All right, question number 2. If you could change one thing about your smile, what would it be?
Oh, so I've already done most of it. I'm pretty happy with my smile. It's not perfect. I think I would just like to use it more.
Okay, fair enough. Fair enough. All right. And then question number 3. If you could go back and be the inventor of any dental product, which one would you choose and why?
I would probably, oh, man. Dental products and why? It's already been invented. Is that what you're saying? I can't invent something new? Okay. Okay. All right. Maybe a weird one. I would like to have invented the Isolite. I am a firm believer that in today's world of adhesive dentistry, isolation is absolutely the standard of care. It's not even an option. And rubber dams have become a bit, a thing of the past, maybe, because doctors really don't know how to put them on efficiently and effectively. And I think the Isolite, Isodry, those products have done a really great job of allowing the average clinician to isolate teeth so that they can do adhesion dentistry with a higher level of success.
I agree. It's a great product. Thank you for bringing that forward for sure. All right, Charles. Well, I want to respect your time and my listening audience. Is there anything I haven't brought forward that you want to share in the last few minutes? And actually, didn't you just have a big program that you put on? Bunch of people came, bunch of vendors. I forget what it was called. Something really awesome happened, right? Talk to me about it.
So we did leadership and operations, the ham and eggs of any business. And because what I have just found is as I teach leadership to teams, we ultimately get to the point where we have to create systems and checklists. And we move from leadership to operations. And whenever I teach operations to teams, checklists and systems, it ultimately becomes about accountability and responsibility and roles and responsibilities. So the two fit together like a hand in glove. We had an amazing event in Cincinnati, Ohio at the Vesper Institute. We filled the room. We're looking to do it again. If anybody wants to know more about what I do, they can go to bluehorsepersonaldevelopment.com.
Perfect. And I was going to ask where people can find you, and we'll make sure that gets in the show notes. Congratulations on that event. There is a ton of buzz around it and how great it was. I mean, others came to me and told me about that. So well done on that, and super excited to see the next one as you launch. And please let us know, and I'll make sure that I share that out on socials as well. I'm super proud of you on that one. That was very exciting to see, my friend. I know that I think it was the first time that you did something with like multiple vendors, multiple speakers. I know that you do a lot of, not one-to-one, but at least where you and maybe like one other person present and do some stuff with your amazing material. But the first time that you did like a big blowout event, as I would call it, for sure.
Yeah, I got to give a huge shout out to my team, Tiffany Randich, Tiffany Fleisch, Caitlin Randich, and Tariq Ali. They worked tirelessly. There was There was no I in this team at all. It was a complete team effort. And I certainly couldn't have done it by myself. I wouldn't have wanted to do it by myself. And so I owe them a huge debt of gratitude.
Love it. Always giving credit to the team for sure. That's what a good leader does. Thank you so much, Dr. Charles Moser, for coming on the Two Sleuth podcast. Such great information, my friend. Make it a great rest of your day. Thanks for being a guest today.